The good point about this analysis is actually that it looks at very carefully at the data which we saw first time in January, the good data on the use of nab-paclitaxel in pancreatic cancer, which is new, right? We rarely saw such a big difference with only one drug added to gemcitabine before. And what Josep presented here is a careful analysis of which factors may predict the response to nab-paclitaxel. What it ends up in the end is that there is not really a big difference between good patients or bad patients or low metastasis and more metastasis. So we can treat all patients with nab-paclitaxel. That's the message of this abstract, even though it's clear that there are differences in prognosis. Patients who are elderly do less well than the youngers. Patients who have more metastasis, who have liver metastasis, do not as good as those with lower metastasis. And those with a lower performance status also do not profit as much from the therapy overall, but they profit all to the same degree from nab-paclitaxel as compared to gemcitabine. I think it expands on the knowledge of the compound nab-paclitaxel. It helps all patients. And what's the new thing is that it tells us that we can easily use it in all patients as adjuvant treatment in the future, which naturally needs to be studied in a trial, because we don't have data there yet, but this is a regimen which likely profits all patients and which can be expanded, maybe also as a backbone to another biological or something like that. So this is a good base regimen which can be used in the future. This regimen has been registered or examined only in patients with normal bilirubin levels. Now, you know that pancreatic cancer patients often have high bilirubin because the bile is not flowing well. So we don't know exactly what will happen if we give nab-paclitaxel to patients with elevated bilirubin levels. And this might explain why in this MPACT trial the treatment time was fairly short. It was 3.9 months, something like that. And that's shorter than we would normally expect. Even so, overall survival was better. The treatment time on nab-paclitaxel was not very long, and we don't know exactly why, because the toxicity looks fairly acceptable. In summary, we can say that this regimen is an option for all pancreatic cancer patients as long as they have a normal bilirubin level. It doesn't matter if they are worse or not as good in shape, but as long as they have a normal bilirubin level, it can be given easily.